You know, we have patients right now that have said, I can't go anywhere. A lot of them said, I've tried pulling out my tooth myself. You know, and that's really an extreme, but we'll get patients to one point where the pain is so severe and they couldn't get into any other office, and they've literally tried to take the tooth out themselves, and they end up, you know, becoming infected and going to the ER.
Community health centers are where the buck stops medically. When people have lost everything, when they've been fired by everyone else and have no place to go, can't pay their bills, they can't go to the ER, they can always be seen in a community health center. And that feels good. I go to work each day knowing I'm going to do something for someone today that if I weren't there doing it, there would be no one to do that for them.
If you really want to help people, if you really want to help people who need help the most, then you want to work in a community health center. That's where you're going to make the biggest impact.
I went to school to help the indigent, the poor people. And so this is what I like to do, and this is what these clinics do. They work with the underprivileged, low income.
I'm originally from Yakima and always knew that I wanted to come back and serve the community that raised me.
Personally, I grew up in Mexico, and so I have a personal mission to treat Hispanic population.
I was really interested in, even before going to medical school, I was interested in working with underserved populations, rural or urban.
We provide full spectrum primary care to our patients. So from prenatal care to pediatric care, care in the hospital, and then care in a nursing home.
Trying to get them up and going, not only their medical, but their dental.
The disease that you see in community health centers these are the people who have textbook disease because they've never sought help from the medical system.
We have a lot of outreach to make sure that women get their yearly exams, their yearly breast exam, mammograms, pap smears.
I'm called a lot to be an advocate. People that are disenfranchised or underserved, I see myself as that, trying to connect them with services, trying to support them.
We're trying to advocate the concept of a medical home, and we're trying to move away from the silo mentality.
We have a great team here, and that's one of the things that drew me to this clinic in particular.
Like, you enjoy the people you work with, and everybody's committed to the same goals.
We try to involve everyone and make sure that we're actually doing a united front.
What we're trying to do is make it affordable, but also make it high quality.
The other real thing about working at a community health center is that there's a real attempt to make sure that you're rewarded financially, that you don't really have to sacrifice that to work at a community health center.
I don't have to manage the business side of it, and it frees up a lot of my time. So I spend a lot more time with my family than I probably could have in a private practice.
I went to a training on depression in Seattle, so the education piece is great.
They're very generous with vacation time, and typically I'm not on call, and so I can spend those weekends with my family and enjoy it.
And it dawned on me, looking at the amount of loan repayment that I have, of loans that I had from school, from the doctoral, it's like a mortgage. I have it for about 30 years. So I thought, I'm going to retire, and I'm still going to be paying $1,000 in student loans every month. And so I just couldn't see myself doing that. And one of my supervisors told me about the loan repayment program.
It has everything to do with the patients and the community in which we serve. It really is really important for me to give back to the community.
It's just amazing how treating them over time, and when they start to feel better, how much better so much is for them. Once their diabetes is under control, then they feel better, they're more energetic, they take care of their housework, they take care of their family, and they get a job. And so it really, you see that over and over again with patient after patient, that if you can help them, then they can, just so much improves for them, not just their health.